Hello, everyone. I'm Frank Daidone, the CEO of Nurse Family Partnership, and I'd like to welcome all in attendance and thank you for joining us today. Also, we'd like to send best wishes that you're all safe and healthy during this time. You've probably all heard from Nurse Family Partnership during this pandemic in one way or another. And as you know, this is a highly dynamic situation. Today, we're here to share the latest updates on the impact COVID is having on our operations, our national network, our nursing workforce, and most importantly, the families and communities we serve. We'll share some updates on what we're seeing on the ground and how we're responding and adapting as an organization. We'll continue to remain committed to serve families no matter the circumstances, and this time is no different. Women continue to need NFP services, and it's more important now than ever that we continue to meet families where they are and address their needs. I'll let my co-presenters introduce themselves at this time. Kate?
Thank you, Frank. Hi, I'm Kate Siegrist. I have the honor of serving as the Chief Nursing Officer for the National Service Office of Nurse Family Partnership, and I reside in Denver.
Christian?
Hi, I'm Christian. I'm Christian Soura. I'm the chair of NFP's board. I used to run the Department of Health and Human Services in South Carolina and was president for the National Association of Medicaid Directors. I've been a cabinet officer in South Carolina and Pennsylvania and led a few different state agencies. My day job is with the South Carolina Hospital Association, and so I've had an opportunity the last couple of months to address these same crises from a couple different perspectives. Some of the members of the South Carolina Hospital Association are local partners for Nurse Family Partnership, and so I've gotten to see it from both sides of the table.
So I'd like to take a second to thank Kate for her leadership during this pandemic. Her role was crucial in the organizational response and leadership in helping our nurses and network adapt quickly. Kate has been out in front of this crisis since it began, giving our nurses the best possible chance to support our families. And then I'd also like to thank Christian for his leadership on the South Carolina State's task force responding to COVID. The support and information he shared with us has been invaluable to our proactive response. We look forward to hearing from both of them today. So we're happy to have some of our most dedicated supporters here today, donors, volunteers, advocates, who give their time, resources, and voices to support our mission. You are all key to the success of NFP and critical in our response to COVID-19. Also, many of our nurses and network partners joining us from around the country, I'd like to express my gratitude for the service and dedication to the families that you serve, especially in the face of this pandemic. Our nurses are truly public health heroes. They are on the front lines of this crisis and are experiencing firsthand the challenges that we face. And on a personal note, it's incredibly special to have so many members of the NFP family with us today. I am more grateful than ever to have a community of support surrounding this organization. It is the strength of this network that changes the lives of 60,000 families every year. Thank you for taking the time to be here. Thank you for all you do to support NFP's mission to serve families. Now, we're going to want to focus our conversation today on the impact on our families and nurses, but I want to briefly touch on our operations at the National Service Office. Our 150 plus NSO employees are based across the country, providing critical support to network partners and nurses who deliver the program to our families. In keeping with our organizational values, we quickly shifted our operations to employees working from home to continue to provide the highest level of service to support our network. Our priorities may have shifted in response to this crisis, but our sense of urgency has only grown stronger. We're doing all we can to support our NSO employees and their families during this time of crisis. And in response, they're working tirelessly to support our network. So here's a brief overview of the agenda today. First, impact on families and communities, updates on NFP's nursing workforce, network operations, strengths, challenges, and solutions, policy outlook and updates. And at the end, we'll have a QA and we'll take some time to take some questions. Okay, just so you know, we're recording today's discussion and we'll share it with all registrants afterwards. Given the size of our audience today, all attendees will be muted and we'll save 20 minutes at the end for Q&A. Feel free to submit questions at any point throughout the presentation in the chat box on the right-hand side. To keep things orderly and efficient, our staff will gather and read out questions to Kate, Christian, and myself, and we'll answer them. Please feel free to share your name and your organization when you submit your questions so we know where they're coming from. We will do our best to get to as many questions as we possibly can. So now I'd like to hand it off to Kate to share some context about the impact on families and communities and more details about our organizational response and operations. Kate?
Thank you, Frank. And before we get into the details of our operations and response, let's briefly back up and kind of set the stage about how our families and communities that we serve are experiencing the impact of COVID-19. And just to state what we always believe and is our mission and our vision at Nurse Family Partnership, the families that we serve are always at the center of everything that we do. So we know that underserved and vulnerable women, babies, children, and families need our services now more than ever. This COVID-19 emergency is not just hitting our families as a health emergency, but they're also experiencing things like job loss, the need to shelter in place, disruptions in their routines, in their services, and their access to community resources. We've heard so many stories of both hardship and courage during this unprecedented time of added stress on families who were struggling before the pandemic. I'll just share one brief story that I heard. One of our Nurse Family Partnership moms, having delivered a healthy child, was experiencing what many women do, actually 1 in 8 women, experiencing postpartum depression. She's isolated more than before the pandemic, and she reached out to her NFP nurse for help. The NFP nurse was able to find her mental health services through a professional via telehealth. And then the nurse was able to check in with her frequently, to have more frequent visits, and also just brief check-ins to provide her additional support. This has made a profound difference to this mom and her family and all the friends in her community. So I'm really proud to say that NFP nursing is continuing with dedication to serve all the moms in our network. Christian, I'd like to hand it off to you if you could share some insights from your experiences in South Carolina.
Sure. Well, thanks, Kate. The first thing that stands out to me is that every community's response in South Carolina has looked a little bit different, which I think underlines the importance of working with people who have the right kinds of community relationships, who understand the resources that are available, and can help connect moms and really anybody who's in a vulnerable position with the kinds of support that they need. We've all seen how different governors have reacted differently to the crisis as time has gone by. And for us as a national organization, it meant that there's certainly things you do centrally as part of one organization, but you need to have a bit of a customized and a tailored approach that can adapt to the conditions on the ground. We've had hotspots in South Carolina that weren't what anybody thought would be the places at the top of our list. We've been focusing on a couple of rural communities that have been ground zero in South Carolina for where the cases have really started to pop up. In all the pandemic planning we've done, in all the tabletop exercises, those were never the places that we thought were going to be first. And so, we needed to respond to that. For all of us who are, armchair sociologists, you sort of think back to books like, Bowling Alone and things that have talked about this sort of unraveling of the social fabric in recent years. In some respects, it's the people who've stuck together who are paying the price for a disease like this that is so infectious. That people who are so accustomed to being together and spending time together, are struggling in some ways to adapt to the sort of to sort of this crisis. We've seen an outpouring of public support for healthcare workers, which has been one of the positive points, and it's something I think we've seen examples of nationwide. We've seen that outpouring in examples that are both substantive and sometimes symbolic, both of which have important meanings for us. We have inmates at our state prisons who are making homemade face masks now in South Carolina, who are making replaceable covers for N95 respirators and all the things that people didn't spend time talking about more than a couple months ago. We have a new partnership with an apparel outfit called Southern Tide that's making this Healthcare Heroes line, and they're dedicating all of the proceeds of that work to caregivers in South Carolina, and that's been a positive spot. Something that we'll talk about a fair amount in the next few minutes is the pivot towards telehealth. And there were a lot of folks who were pretty skeptical, I think, of telehealth even just a couple months ago. And for folks who are familiar with HIPAA, I will say that I have my dad's consent to tell this story. But my dad is 75 years old. He had his first telehealth experience with a pulmonologist on Friday. And he said, I don't know why I didn't do this before. This was pretty easy. It was just as, I got as much out of it as I thought I would have had from a face-to-face encounter. And so all of us are trying to figure out how do we move to that kind of model. And especially for this, being NFP being what we tend to think of as a nurse home visiting program, when you can't visit homes, you've got to pivot pretty quickly. And so I would just real quickly say thanks again to Frank and Kate and the entire team for everything they've accomplished in the course of the past few weeks to help move NFP to where we need to be in order to keep serving moms and their babies.
Thanks, Christian. I really appreciate your words. I want to talk for a few minutes about the impact of this health emergency on our NFP workforce and operations. Nurse Family Partnerships, we have about 2,300 nurses across the country that have NFP on their name tag. Just like everyone in this country, we're being impacted both personally and professionally by this emergency. Many, though not all, of our operations, of our implementations are housed in public health departments. So the impact is clear and it makes sense. We're seeing many of our nurses, some of their time being diverted to work on COVID-19 emergency duties, responsibilities. This is the right thing to do. We have professional, experienced nurses in health departments serving our moms who are now, with commitment and dedication, continuing to stay connected with our moms while also serving in the COVID emergency arena. We are tracking this very carefully. As of this week, of our FTEs or full-time equivalents across the country, approximately 13% of the hours that we have to serve moms have been reassigned or diverted or redeployed to COVID-19 activities. And about 14 to 14% of our nurse supervisors as well. So we are seeing significant diversion of the hours that were allocated to serve moms. However, I am so proud to share, and we'll talk a little more about the data later on, that even with this reallocation of time to COVID-19, we continue to stay connected and to serve our moms with a deep connection to Nurse Family Partnership. So we are tracking this really day by day through our nurse consultation network across the country. We've also seen an impact on the service, the way that we connect with moms. Clearly, just as Christian noted, is the pivot to telehealth. We had to quickly change how we deliver care nationally to our moms by converting to telehealth only as of March 17th. Now, I want to say that the response that we have gotten from our nurses across the network has just, it's inspiring. It inspires me every day. Within 3 weeks, 100% of our network partners had embraced and implemented telehealth. Prior to the pandemic, it was about 85%. So our partners heard the call. They worked with the nurses from the National Service Office to convert to telehealth. We've also lifted any restrictions or limitations on the use of telehealth, as has Health and Human Services and HRSA, as Christian sort of alluded to in his words. So nurses now can use telehealth at any phase of the program, and there's no requirement for in-person visits, clearly, until it is safe and prudent to do so. As I mentioned earlier, even with this significant change in the way that we deliver our day-to-day services to moms, we were able to enroll close to 500 new mothers in March. That is pretty much on target for what we do year over year in the month of March. That is phenomenal. That is inspiring. We do anticipate that as the months go on, we will see some fall off in our enrollment. That would make sense, but we're just watching it. And I'm just really, really proud to be able to represent the network of nurses and applaud their efforts in moving to telehealth. Our visit numbers also are holding steady. Nurses are reaching out and they're supporting their moms. So the slide that you're seeing shows, you can see the hockey stick type increase in the percent of visits that are conducted via telehealth. Prior to this pandemic, we were running, as you can see, 7.5% to 8% of our visits were delivered via telehealth. The sudden increase now, in over 2.5 weeks, we have gone to over 97% of our visits are being conducted via telehealth. And the other data point you see on this slide is of the visits that are scheduled, what percent of those visits are completed? And what it just, again, I'm so honored to be a part of this, the nursing team. You can see that in actuality, we saw an increase in the numbers of completed visits through this pandemic. As we've increased telehealth, those visits that are scheduled are being completed at an actual higher percentage, 85%. This demonstrates that our moms want and need to be connected to their nurse-family partnership nurses. And we are rising to the occasion. We are staying connected with our moms. I want to talk a little bit now about our strengths going into this pandemic. Although none of us could have ever imagined that this would be where we are in April of 2020. In truth, nurse-family partnership had already built the foundation that allowed us to pivot so quickly to delivering services that respond to the crisis in our communities. Our model and approach to care is built to be adaptable and to respond to the changing needs and circumstances of our clients. We are still delivering our services, and we're doing it well. We were prepared to respond quickly, to minimize disruption in services, and to keep families connected. Telehealth as a method of delivering services has been part of the NFP model actually since the very early days of our original trials in the 70s, 80s, and 90s. However, it formally became a part of our delivery system in 2017. So as I mentioned earlier, just before the pandemic, 85% of our local network partners were delivering services in part through telehealth. And again, remember, 7.5% to 8% of the visits. And they were able to embrace and bring on board this system and to go to full telehealth over the course of 2.5 weeks. I'd like to take just a moment to share a brief story from one of our network partners as an example of how NFP nurses support their families via telehealth. A young first-time mom in the last month of her pregnancy in New York became confused about her prenatal visit appointments when she was told that she wouldn't need to be seen again for 4 weeks. that's a sign that the health system is disrupted and that there's some confusion. Now, the NFP nurse knew immediately that this was a misunderstanding because it wasn't with the pregnancy. Moms should be seen weekly. That is the routine state of affairs for moms in their last week of pregnancy. So as the NFP nurse reached out to this mom, she also became aware that the mom was running a fever and that she'd gone into the hospital, into the emergency room the day before to have the fever evaluated, was diagnosed with an infection of the urinary tract, and was sent home and with a called-in prescription for antibiotics to her pharmacy. Well, as the nurse talked to her, the mom shared that when she went to the pharmacy, the medication wasn't there. So the mom, exhausted and not unwell, went home and continued to run a fever and started to develop pain in her lower back, which can be a sign of kidney involvement, which is very, very serious, particularly in pregnant women. So the nurse was able to talk to the mom, assess over the phone, how she was feeling, what was going on with her fever, and encouraged and supported the mom to go back to the emergency room immediately. The mom did that. She was evaluated and admitted to the hospital with a severe urinary tract infection and with potential kidney involvement. The mom subsequently delivered a healthy baby boy, and because she was seen at the hospital and admitted, she was treated properly with antibiotics, and she was able to get through her delivery and is now with her baby with no kidney damage. And she is now healthy and well in her postpartum period. So all of this, shows that the NFP nurse actually kind of virtually held her hand as she navigated this complex complication of pregnancy. And she was able to stay virtually with that mom through this crisis and see her through the other side and continue to serve her through NFP. This is just one of innumerable examples of how nurses continue to be able to assess and manage and support their families through telehealth. I want to give one more example of what the National Service Office is able to do in response to this pandemic. Our nurse education team had responded quickly to pivot education for nurse home visitors and nurse supervisors from in-person to virtual platforms. Our team created a 2-day session series that prepares new nurses to enroll and serve moms. Now, these nurses will still come to Denver for their full week of education when it's safe to do so, but they have the skills and knowledge and support they need to start enrolling and serving moms after these virtual online sessions. I am pleased to share that through virtual education, we were able to prepare 40 new nurses in April, and we already have 46 nurses registered to attend our 2 sessions in May. That is the largest number of new nurses educated in May ever. So that is a sign that nurses are ready, our local partners are ready to continue to hire and educate nurses to enroll and serve moms. I am so proud of the dedication and determination of our wonderful nursing network across the country, who are committed to ensuring families in need continue to receive services in ever-growing numbers. The bottom line is that NFP nurses haven't skipped a beat. So I'm going to turn this back over to Frank to talk a little bit about some of the other challenges and solutions that we are seeing across our network.
Thanks, Kate. As Kate shared, as an organization, we were well equipped to deal with this pandemic. We've largely been able to respond and mobilize our network quickly. But every day is different, and we're still encountering challenges that require us to keep adapting. Kate and I will share a few of those. One of the first things we saw was a technology gap. As we switched over to telehealth in the first few weeks of the pandemic response, we were hearing from our network that not all clients had phones. Without a phone, the nurse had no way to stay in contact, and we were at risk of losing them from the program. We knew we needed to respond quickly to reconnect our families to their nurse because the relationship that they built will now be needed more than ever. We immediately surveyed our entire network to understand the full extent of this technology gap. And what we learned was that there was at least 2,000 moms in the program nationwide that lacked cell phone service that prevented their nurses from reaching them via telehealth. So we came up with a solution. We are now partnering with Verizon to invest in providing phones with 4 months of data and service to clients who need to connect with their nurse. We are grateful to Verizon for their partnership and for all the hard work our nurses and network did to get this information back to us so quickly. And there's probably some of you on the line today that were involved in this process, so thank you. And I'd like to say, and I'm happy to say, beginning today, we will be sending out the initial shipment of more than 1,000 phones to our moms in 68 different local programs in 25 different states. It's pretty incredible.
You know, I would like to take this opportunity to talk about some of the more difficult areas of service that we need and are committed to continuing throughout this pandemic. As you all know, NFP is, we are designed to serve the highest risk moms and families in your communities, the ones who need us the very most. And we know that some of these families are experiencing complex health issues that go beyond physical health. They may be experiencing mental health issues, substance use disorders, and some of our moms or families are living in households where there's violence, where there's intimate partner violence or child maltreatment. We know this. Our nurses count on being able to go into the environment to assess and respond to these issues. But in these times of the COVID emergency, we are needing to think about how can we continue to be sensitive to these issues through telehealth. So unfortunately, we also know that in times of hardship, in times of economic stress, and in times of general stress, these issues tend to, or often, either show up for the first time or are exacerbated by the crisis, by the stress. And again, we're talking about, you know, the issues of isolation, mental health, substance use disorders, and intimate partner violence and child maltreatment. We wanted to respond to this. We wanted to make sure that our nurses have what they need to feel confident about assessing and supporting families through this, even though they may be limited to a telephone or ideally to a video conferencing platform. So we connected with our subject matter experts that have helped us develop that curriculum that's embedded in our program already to say, could you help us support the nurses to go deeper, to understand how they can continue to assess, determine where the needs are, connect these moms to services, and support them ongoing. So we have been very privileged to work with experts in the field to develop this enhanced guidance and provide that guidance both in written form and through our own video conferencing technology with our nurses across the network. And as we see other needs arise, as we hear from nurses that they need additional support in other areas, we will continue to respond. I'm going to turn it back over to Frank to talk a little bit more about the impact on our workforce.
Thank you. Yeah, as Kate mentioned earlier, some nurses are being redeployed from delivering NFP. I think she mentioned currently there's about 13% of our nursing workforce time is being impacted. This is especially prevalent in our public health department sites, where our nurses are being pulled to respond to COVID-19 in their communities. So NFP has put support in place to help nursing teams rebalance caseloads or keep in touch with clients even when there are vacancies or disruptions. Our teams are employing flexible and adjusted visit schedules to prioritize the highest need clients and increase capacity to maintain service to families in the event of workforce reductions. Telehealth is also an important piece of this. Not only does it allow us to serve families safely, it allows nursing teams to more easily cover caseload shifts and stay in touch with families. So beyond our operational response, we're paying close attention to the political environment surrounding the pandemic and doing what we can to advocate for policies and resources that will support NFP families and nurses. So I'd like to turn it over to Christian to share some high-level public policy updates and what we're watching next. Christian?
Thanks, Frank. Yeah, I think when you're in a crisis like this, you are reminded of the power of relationships. And we have worked very closely throughout the past couple months with elected officials, with members of Congress, with governors, with their department heads, with state legislators, with local health officials, because there's been so much changing on the ground. I mean, literally every day we've had new federal guidance from the CDC or from the Centers for Medicare and Medicaid Services. We get new public health orders, new governor's executive orders every day, and so we have to stay on top of all of those changes as they're released, make sure we understand them, and to the extent possible to make sure that we inform the choices that are being made by public office holders throughout this ever-changing situation. NFP's been a leader in coordinating with Health Resources and Services Administration, which is the entity at the federal level that oversees the McVie program, the Maternal, Infant, and Early Childhood Home Visiting Program. That's been an important funding source for us through the years, and we've stayed in touch with them to make sure that as we pivot to telehealth, as you've already heard in the past few minutes, that we can do that in a way that doesn't violate the terms of some of our funding agreements. We continue to stay in touch, working closely with state and local and tribal authorities, with other home visiting partners, because in many respects they're in the same boat that we're in, and to keep in touch with other organizations and advocates and community entities that are involved in serving the same kinds of families and households that we do. We sort of jumped over and talked about some of the operational impacts a little bit ago, that as we all get used to working from home and living our lives on conference lines like this one, that's impacting states and counties and their ability to run some of the programs that matter to us too. And so we don't just talk to the elected officials and the policymakers, we also need to stay in touch with the people who process applications for Medicaid or for SNAP or for TANF or for any of the other programs that are important to the moms and the children that we serve. We've been tracking the potential impact on these funding streams nationwide and locally. We've been monitoring closely now 3 pretty significant pieces of legislation that Congress has passed in the past month or so. It adds up to several hundred pages when you wade through all of it, and those several hundred pages of legislation produce tens and then hundreds of pages of their own implementing regulations. And so we have to make sure that we're paying attention to what's in those rules and that they'll be structured in a way that serves the people that we serve. More information about provisions for families that are affected by those actions will be available in our new public policy update, which we'll be sharing at the end of today's discussion. I mentioned the 3 bills have moved so far through Congress. There's a 4th one on the way. We don't know when necessarily. We've heard that Congress is likely to remain out of session until May 4th. But just because they're not necessarily banging the gavel from one day to the next doesn't mean that they're not working. And we continue to stay in touch with members of Congress and their staff as those talks continue to progress about what a 4th bill might look like. I can tell you, even for my part, in the past week, I've talked to both the South Carolina senators, I've talked to 2 of our House members, and I've talked to staff for the other 5 offices along the way. I mean, so all of us are involved in some way in making sure that we stay in contact with these policymakers. One of the things we've asked for is a one-time appropriation for that McVie program that I mentioned a few minutes ago to help support telehealth training and some of the needs that our families are going to have. Obviously, there's a lot of different bits and pieces of those 3 packages. Many of those are going to have some kind of positive impact for the people we serve, but there are still gaps in some places, and we hope that those wind up being addressed in a fourth bill. We'd like to ensure that telehealth visits are considered home visits, at least for the balance of calendar year 2020, and that's something that we continue to talk about with federal policymakers. And we'd like to ensure that all the funding and staffing levels for McV-funded home visiting services are maintained regardless of some of these temporary enrollment reductions. I mentioned a few minutes ago that we're a little bit concerned about whether or not staff are available to process applications for some of these services, and that provision would help make sure that just because eligibility workers are at home or are unable to work in some of these systems, which are being taxed in many respects more than they ever have been before, that doesn't wind up being a barrier for the people that we serve. So I think that is a quick rundown on sort of what we're looking at as a kind of a high-level policy agenda right now. But I would also say that for those of you on the call today, as you identify other needs, if there's other things that you think we should be doing as we stay in contact with policymakers, things that we could be doing or things that we could be encouraging them to do to help the families we serve, please do let us know as we move through this webinar and then also afterwards. Frank?
I'd just like to say thank you again to Kate and Christian. We've been humbled by the outpouring of support for our families and our nurses, and many are wondering still how they can help at this time. So here are a few ways you can be involved. You can refer a mom. NFP is still enrolling new clients to the extent possible. You can also make a donation. NFP relies on the support of donors to ensure that our services are accessible to as many families in need as possible. So if you're able, please consider making a gift. And then there's Thank a Nurse. We're doing all we can to honor and thank our public health workforce, including our own nurses. You can also visit our COVID-19 page on our website for more resources and updates, as well as a future public policy update. Thank you all for attending today, and we're going to now transition to Q&A. As a reminder, please feel free to submit your questions in writing in the chat tab on the right-hand side of the screen. If you can, include your name and organization if you wish. Our staff is online and they will read them out one at a time, and we'll do our best to get to as many as we can. Go ahead and pass it to Afton to go ahead and ask those questions.
Hi, Frank. Can everybody hear me?
Yep.
Yeah.
Okay, great. So one question that's come in is whether you can speak a little bit more to whether we're losing clients or losing track of clients during this pandemic, and what we're doing to prevent that.
Yeah, thank you. I'll take that question. I am really inspired by the fact that we're not only not losing clients, that we're actually serving more moms than ever. So in the month of March, between the end of February and the end of March, we increased the number of moms we serve across the network by close to 500. So we are enrolling new moms virtually. And I am very proud to say that even through the transition to telehealth, that week over week, we are maintaining, and in fact, this last week had an increase in the numbers of home visits that were completed in the week. So we are tracking, we're talking to the nurses. Our concern, when I was asked, what's your biggest concern with staying connected to moms, our moms need phones. So those moms that we can reach, we are reaching. Those moms who need us, we are enrolling. And those moms who've lost connection because of technology challenges, we are addressing that directly. Will we have some moms that are hard to find? Absolutely. We're going to have moms and families that are experiencing housing insecurity. They may lose their place living. They may go off grid for a bit, but we are diligently staying on target with trying to keep and connect with our moms. I hope that answered your question.
Thanks, Kate. And I will say we are getting a number of questions, it looks like, from the network about how to access phones. So I will just go ahead and submit in the chat a resource that our nurses and network can access if you have questions about that. Another question, Frank, this is probably best for you to take. Are we at the National Service Office changing the way that we do business, or might this change how we do business in the future?
Yeah, absolutely. That's a great question. There's been a lot that we've learned from this current situation. We've learned that we can adapt and we can become very agile. Again, just like our partnership with Verizon and some other areas that we're looking at right now. I mean, this isn't something that everybody else is doing necessarily, trying to make a pivot and to support our families in another way. So knowing that, I mean, we're going to continually look for other learnings. The telehealth opportunities that are presented right now also present possibility of higher efficiencies. With higher efficiencies, you have lower costs for service delivery. So that's another area that right now is becoming, very interesting to us. And again, I just can't emphasize enough partnerships, not just with Verizon, but also with our entire network of nurses.
Do you see any risks in the future to public funding for NFP programs? Christian touched on this a bit, but wonder if you could speak a little bit more to that.
Now, right? But one thing that we've seen pretty clearly is that the federal government is willing to act. I mean, they have spent literally trillions of dollars in the past month or so trying to respond to this, and people have stepped out of their traditional sort of political lanes, I think, in order to dealt with, the financial barriers to care, to make sure that people get the help they need. I mean, so I wouldn't want to be, overly, Pollyanna-ish about whether or not people are going to take, lifelong lessons away from this crisis. But I would say that, the response that we've seen from the federal government in the past month has shown that they are willing to open their wallets in order to make sure that people have access to the care they need. They have waived rules that have been barriers to telehealth for years and years and years. And I mean, there are things that I've talked to members of Congress, I've talked to federal agencies about for the last 5-10 years, and we couldn't get past first base on those things, and suddenly they're the law of the land. So, many of the actions that at least the federal government has taken in the past month are temporary. They're tied to the sort of the declared period of the public health emergency that we've been in since the very end of January. But I know many of us are going to continue to talk to policymakers about the need to make some of these changes permanent. So I would say, at least for now, I feel reasonably good about their willingness to support public health and sort of related programs. I just hope that they stay on the right track. Well, we'll see soon.
Thanks, Christian. Kate, this is a good one for you. Can you speak at all to how we're supporting nurses at this time, and particularly around the challenges that some of them might be facing with delivering telehealth while at home, many with children, and how we're supporting nurses in that way?
Yeah, thank you for that question. NFP is all about the nurse and the mom and their connection. So we are focusing on what our network needs. I will say, in general, what supports our nurses is creating a way for them to continue to serve their families. Our nurses are so mission driven and so committed to their families that if we can provide ways for them to stay connected, like through phones, like through telehealth, we've been getting amazing messages of gratitude from the nurses. In terms of the nurses themselves, we have developed a webinar on telehealth that was developed really over a weekend and delivered across the network in a week and a half that helped nurses to understand how we are adapting our telehealth guidance in response to this emergency. And then our nurse consultants, we have 20 nurse consultants across the network that are in touch with every one of our network partners on a regular basis to find out what's going on, how are they doing, what are the stressors that they are experiencing. We know that nurses are experiencing secondary traumatic stress from this. And it's not just their professional lives, but as the questioner mentioned, their personal lives. We're all experiencing this personally and professionally. So to that end, we're working with agreement with a partner in wellness here locally in Colorado, and we will be very soon launching an online series of wellness-focused resources for our nurses, from mindfulness to yoga to really just creating virtual spaces for nurses to connect to each other. So we were built to respond because we work virtually, and this is our regular kind of business as usual in some ways. So creating additional spaces for nurses to talk to each other. There just is nothing like peer-to-peer support, just to listen, just to be there, just to acknowledge what we're going through. And I want to say that we are well aware that the tail on this stress isn't going to end when happily this infection crisis is over with. The impact of this economically, with our stress, with our trauma, is going to go on for some time, possibly years. So we intend to intentionally provide ongoing resources for our nursing network well beyond the time that this infection has started to die down and hopefully, trail out. We know that this could go on for years, and we will continue to provide those services. So again, online services around opportunities for wellness, opportunities for mindfulness and yoga. We've shared a free link to one of the wellness or mindfulness apps called Calm. We've also shared resources from another app called Headspace. So we're trying to make these apps available to nurses who want to do that as well. We'll be developing podcasts that help nurses kind of get into a space where we can experience the level of gratitude that we have.
Great, thank you for that. We are getting a few questions about referral sources and whether, if we're hearing on the ground that referrals.
Reality is, yes, our referral sources are being impacted. We may have referral sources that are overwhelmed, like if they're sources coming from healthcare providers. We have many referral partners who are healthcare providers, obstetricians, gynecologists, family practice, pediatrics. So with the increase in new enrollments, we are receiving referrals. And I think, we talked a little bit about what our lessons learned and what we can carry forward after this is really how to maintain those relationships. So the truth is our referral sources are being impacted, but the truth also is that we're enrolling moms at a rate comparable to where we were prior to the pandemic. So we continue to call, we continue to support our partners to call their network and continue to maintain those relationships so that when they reopen or when they're able again.
Great. And similarly, we have a question of if we have any projections about potential demands for the program in the next 9 to 12 months. Do we have any more long-term projections there?
I'd like to take that and then perhaps, I don't know if Frank has some additional words. I want to bring up something that's really important. This time of crisis is also a time of opportunity. NFP nurses are a critical component of our community's health network, often leaders in the team for some of our moms. So this is an opportunity for NFP to really step up, as we always do, but to really step up and say, this is why we use baccalaureate prepared nurses. This is why we support our nurses in their roles as public health nurses. This is an opportunity for us to say, the reason we can respond, the reason we're making such a difference is who we are. And so in terms of what's going to happen, none of us can predict. None of us can predict what the future is going to look like. And that's an uncertain time for all of us. But I will say that NFP has really demonstrated our value, our return on investment, and our ability to really mitigate some of the impact of this crisis. And I intend to work with my partners at the National Service Office to shine a light on that as we move forward, to shine a light on the critical, essential nature of NFP nursing in the health of communities and families and individuals. So it is my hope that we will see an increased demand as across our country, our partners realize what an absolutely essential role we play in helping to mitigate the impact of this crisis. Frank, I don't know if you have any additional thoughts on that.
Yeah, so, I'll just reiterate, you were breaking up a little bit for me, so if I repeat something you already said, but when you're looking at the economic climate and you've got millions and millions of people filing for unemployment, on a weekly basis, you have to imagine that demand is absolutely going to increase over time. So hopefully, local governments and states all are going to acknowledge that, and then hopefully they're going to be able to provide the funding and support that we need to reach and address as many of those families as we can. But also an important part of that is the voice that you all share. Everybody that's on this webinar right now, I mean, to get the word out that NFP is here, we're here to support families in your communities. That is really the power of this network and who we are. So it's one thing to have capacity to serve. It's another thing to have the demand from our families, but we've got to get that word out. We have to let them know that we're here and we're here to support them. So I can't stress enough the importance of everybody on this call right now and being part of that bigger picture and getting the word out, especially at a time like this.
Great, thank you both. We probably have time for just a couple more before we need to wrap up. Frank, this is probably best for you. Similarly, are there any financial concerns for the national service?
And, honestly, yeah, no, we are in a very strong financial position right now because of our supporters, because of the people that give, and also because of the need that's out there. So we've, over the last, many years, have been very smart and wise about the way we've invested our resources. We've planned ahead for things like this to potentially happen, whether it was another recession or now here we are dealing with this type of crisis. So that said, more importantly now than ever, no, we're not making any reductions to any kind of services. In fact, our goal is to maintain the same level of services for families. We may allocate our resources a little differently, but we are still committed now more than ever to serve families, and we're financially in a position to be able to do that. And that's thank you to all the supporters that we have out there.
Great, thank you. And I think we'll probably have to make this our last question of the day, but given the shift to telehealth, is the NSO addressing how to get much needed supplies directly into the hands of moms who may be in need at this time.
So can you repeat that again?
Yes, is given the shift to telehealth, so nurses not seeing their families, is the NSO addressing how to get much needed supplies into the hands of moms safely?
To get supplies into the hands of
Yes.
safe? Oh, well, if people are looking, I mean, we are doing everything we can right now, just like we are with the cell phones. You know, we're going to continue to assess the need of the network, and as that need goes up, we're going to do everything we can possibly do to address it, right? I mean, that's why we quickly moved and addressed what we could today with 1,000 phones going out. So as we continue to see more needs, and we know that those needs are on the ground, we're going to be very open-minded in our approach to what else can we do in these local communities. But you know, the scale of what we're trying to address is dramatic. So if anybody on this webinar is interested and they want to be able to provide like local assistance, I mean, please, you know, by all means do reach out to your local United Way, the diaper banks, the food banks, anything you can do.
Have always and will always be absolute experts in what community resources are available for their families. So now more than ever, our nurses are helping families search out the local supply chains, the local supply opportunities they have for their needs. So NFP nurses know their communities, they know how to shake the bushes, they know how to make the calls and help moms and families get what they need from local.
Okay, I think we're out of time, so I'll go ahead and wrap up. You know, we'll review any of the remaining questions that we weren't able to get to and share in writing as needed. You'll all receive a follow-up email to this webinar with a recording. And again, thank you again for joining us and your support and partnership. We look forward to being back in touch soon, and we wish you all well, your families well, your friends, and thank you for being part of this NFP family, and thank you for being here today.